Hi, everyone. It's DocTalk. It's the beginning of November. The news of this morning is that about half the country is freezing, under freezing temperatures. So it is clear we're heading into the winter season. So stay safe. That always means an increase in our run volumes on the fire side. And a lot of cold mornings and a change in dress and gloves and all that kind of stuff. So please be safe as the seasons change. This week, a lot is going on. The news on COVID is good. And some of our better prognosticators said, let's think ahead into the winter. What are we going to do preparing for the winter? They believe the Delta wave continues to decline and there's no serious variants that are moving into the world or the country at this point. That there are ongoing risks for the unvaccinated, and that unvaccinated population is still about 65 million Americans, 65 million Americans unvaccinated. The immunity is clearly waning over time. And from international studies, we are seeing very clearly that people who got infected early and did not get a vaccination are at risk for infections. Those infections can sometimes be serious, although less risk than the first time. It is also still a time in North America where there are outbreaks occurring and where we're waiting for the infection rates to go down. And typically it's down below a 5% test rate that tells us that we can begin to convene again, that we can begin to remove our masks in public places a little more comfortably, although we still need to stay home if we're ill. And that's going to be the important lesson of this winter is stay home if you're ill. Don't risk spreading any kind of infection to other people. And there are still unknowns in the COVID outbreak. This week, we passed 750,000 COVID deaths in the United States and 5 million deaths worldwide. A tragic amount of deaths, many of them occurring in public safety and in the fire service. And at this point, we're still at a pace of about one firefighter a day dying of COVID. That's way too many. Positive news. This is the week that the FDA and the CDC approved immunizations for children 5 to 11, the Pfizer immunization. I want you to know there's really good reasons why we want our pediatric population to be vaccinated. Number one, there have been 6 million children already infected with COVID. About 24,000 of them were hospitalized, and there are some deaths. Clearly less risk than in older adults. Nonetheless, they are still a vector. That means when they get infected, they can spread it to other people. If we can stop the spread by young people in this country, we believe we can prevent about 600,000 infections in the country before March of 2022. So that's our best estimate about how many kids are going to get vaccinated and how many infections, both amongst children and amongst others that they may spread to, that we can reduce the impact of COVID by that much. The safety data in pediatrics is very strong. That is one of the most important elements that both the FDA and the CDC evaluated. And the FDA, the CDC, and state health departments have all recommended pediatric immunizations in the 5 to 11 age group. Right now, there's just one vaccine, and that is the Pfizer vaccine. It is given at a lower dose than in adults. It will be available in a wide variety of places across communities. Check in your own community where the immunization sites are. For those of you involved in the pediatric immunization program, I'm going to tell you, we went through a lengthy conversation with the CDC yesterday. There's a lot of differences in the preparation of the pediatric vaccines from the adult vaccines. So those of you that are going to be involved, you're going to be given a rigid new set of instructions about the pediatric vaccinations. It's a different dose. It's a different vial. It's a different prep. It's a different set of expiration dates. All of those things really important that we get done well. And you're going to find that there are localized sites who are going to get very, very skilled in being able to deliver the pediatric vaccines as opposed to the adult ones. For those of you involved in the immunizations, really good idea to work at one of those places and help improve our societal safety as well as the safety for those children. Another big item for this week is the authorization in the United Kingdom of a new pill from Merck, Molnupiravir. Molnupiravir is an oral medicine. The oral medicine dosing is 40 pills in 5 days, and it reduces the risk of hospitalization and death amongst those who have taken it and are infected. It is more effective if given early. So that means early symptoms, means early check, means contact with the site that has those oral pills available. And it is licensed for production in the United Kingdom. It will be licensed in other countries. It is currently under investigation for authorization by the FDA in this country. We should hear news about that in the coming weeks. I want you to be aware of it because it's clearly in the national news. And this drug, which was actually originally invented at Emory University in Atlanta, will be licensed for production in many other countries, particularly countries that don't have the resources for vaccination or other treatments. In this country, monoclonal antibody treatment available also. We don't have comparison of the two, but monoclonal requires either injections or an IV infusion. So it requires you going somewhere and getting that treatment as opposed to the 40 pill treatment. That is not available as yet in the United States, but it may be coming soon. And finally, boosters. A lot of news on boosters this week. Most important for those of you who got the J&J vaccine as your first vaccine, there's really an opportunity to mix and match and get one of the other mRNA vaccines, which is Moderna or Pfizer. It is available for those of you who are 2 months past your J&J vaccination. It really boosts antibodies in an incredible way if you get an immunization with Pfizer or Moderna. At this point, where we're looking still at the Delta variant in this country, getting a booster is a very reasonable way to protect your health. The current recommendation for those of you who got Pfizer or Moderna is at 6 months, if you're over age 65, if you're at high risk, or if you've had high exposure risk, which is all of us in Fire EMS, that vaccine is available to you. For the Pfizer, it is the same dose as your original dose. For the Moderna, it's a half dose compared to what you got in your first and second injections. I'm included in that group of people. I'm going for my booster because I'm at the 6 month period. My family will be going for that also. That's how strongly I feel about it. So we are at a point where a lot more experience is in the place and been studied on our vaccinations. There were 2 new publications this week about the safety of the vaccines over their initial life, and we're getting almost 10 months in this continent in our experience with the vaccines. They're proving very safe and very effective. And in preventing another wave of COVID for 65 million people who are unvaccinated, it's really important that we be looking at those vaccines. We're in November. We hopefully are looking at a really good time going into our cold months now. We want everybody to be protected before we get into holiday celebrations and the times when we really do want to come together. A nice story this morning is people who were getting their 5 to 11-year-olds immunized and then making travel plans because they knew the 3-week interval for that second immunization will come in December early on. And at that point, 2 weeks afterwards, their children will be safe and will have their vaccination card and be ready to go. I hope all of you are staying safe as we move into the cold time of the year and the time of the year when we we got to protect ourselves from all kinds of infections. Stay home if you're sick, wash your hands, wear a mask still in the places where you need a mask. Take care of yourselves and take care of your community. Thanks a lot. Talk to you next week. DocTalk.